Good morning, everyone. I'm the Chief of Personnel, Martin Morales. With me today is Chief Maddrey, Chief of Community Affairs, Inspector Gazis, the Commanding Officer of the Medical Division, and Dr. Climbing, the Supervising Chief Surgeon for the NYPD. I'm here today to speak on behalf of the NYPD regarding our vaccination rollout at our community center here at 127 Pennsylvania Avenue. As the Chief of Personnel, I oversee the health and well-being of our members and serve as the head of all human resource functions from pre-employment screening through retirement. In addition to other responsibilities, I'm also tasked with directing and coordinating operations of the Office of the Supervising Chief Surgeon and the Medical Division. I am very proud of our Medical Division efforts as they have proven to be an invaluable tool during the COVID-19 pandemic. Since January 6th, under the supervision of Inspector Gazis and Dr. Kleiman, and the Executive Officer of the Medical Division, Captain Hotziglu, the Medical Division administered over 17,000 vaccinations to members of the NYPD, and that's still 34% at this time of our department is vaccinated. In addition, the Medical Division has also vaccinated over 700 auxiliary officers, over 700 members of other agencies, and over 5,000 eligible retired members of the NYPD. In January, we also vaccinated over 1,300 senior residents of the Polo Grounds in Manhattan and the Cassidy Lafayette houses in Staten Island. To date, our medical division has administered over 25,000 first doses, and they also administered over 17,000 second doses for a combined total of 42,000 vaccinations. This was a huge undertaking for both the medical division and the Personnel Bureau, requiring coordination from the department's physician staff and nurses. And our medical team was supplemented by NYPD officers, uniform officers, who were identified as trained paramedics and mobilized from the field. In collaboration with City Hall and the New York City Department of Health, we outfitted this NYPD Community Center here at 127 Penn to vaccinate eligible members of the public. The NYPD will be operating this vaccination center Monday to Friday from 6 a.m. to 2 p.m. until the end of May. We began operating this NYPD Community Center as a vaccination center, as the New York City Vaccination Center, last Thursday, March 11th, and our medical division team has already vaccinated over 3,000 members of the community with the Johnson & Johnson one-dose vaccination, over 3,000. If we maintain our current pace, we anticipate vaccinating over 40,000 members of the community by the end of May. Appointments can be made on the New York City COVID-19 Vaccine Finder website, which is vaccinefinder.newyorkcity.gov. That website again is vaccinefinder.newyorkcity.gov. You have to qualify to get the vaccine, which includes New York residents 60 and over, or adult New York residents with a qualifying medical condition such as cancer, kidney disease, and heart conditions. A full list of medical conditions can be found on the vaccination website. And once again, I'm very proud of the work the medical division has been doing, and we have uniform officers and nurses and doctors who are here today vaccinating members of this community. And I'm confident that the NYPD's vaccination efforts together with this community vaccination center will play a vital role in the city's recovery. The combination of getting vaccinated and following CDC guidelines to protect yourself and others will offer the best protection from the COVID-19. And I thank you for that, and happy St. Patrick's Day. And, I'm going to introduce Inspector Gazis, who's going to talk about the process, what happens after you make an appointment, and he's going to introduce some of our uniform officers who are administering the vaccination today. Tony?
Thank you, Chief Morales. So again, I want to begin with saying it's our honor and our privilege to first, the NYPD Medical Division is able to vaccinate our members of the service. With that, like Chief Morales just noted, that we've expanded it to retirees, and we've also been able to now vaccinate others, and others meaning the community. And again, it's an honor and a privilege to be able to do this, to help out, to help the city of New York, and again, to further help everyone in the city to get past COVID, to get past this horrible disease that has hurt so many. So again, earlier this year, we went out to the NYCHA housing developments. We were able to do, people that live in housing developments in NYCHA in Manhattan and in Staten Island. Now we've opened it up here in Brooklyn, and we have a lot of people. The demand is really high, but anecdotally, I'm so happy. I talk to everybody on the line, probably a little too much, and I get to hear the stories of, it's a pleasure coming over here. It was easy to get this appointment. Your staff members are very courteous, and I like to hear that. And that's what I want to hear. I want to talk to the people who are coming in, getting the vaccination. They're telling us that the wait time is not long at all. So they're happy to be here. They're happy to be, again, serviced by this, building. And most importantly, they're very impressed that they're all NYPD members of the service. So our staff here includes doctors that are NYPD medical surgeons. We have nurses that are civilian RNs, and we also have police officers that are RN nurses, and we have paramedic officers that all came together to help us with this venture. Now, the officers that we've recruited, the medical division didn't have the amount of people we needed to open up these pods, this amount of, to have this type of influx of people. So with that being said, we reached out to patrol, and we found officers that have these qualifications that are able to vaccinate. And again, it's been tremendous, the positivity. The officers that I talk to, my staff, are happy to be here. They're happy to be doing this job. It's very fulfilling. It's very fulfilling. And they go home at night really knowing that they're helping the community and their fellow officers. So at this time, I'd like to, introduce, I got P.O. Grant and Officer Javorovac. Please come up to the podium. So Officer Javorovac is a paramedic, has been working as a paramedic for quite a few years. I'm gonna let him take the podium and just tell a little about himself and what he's done and how he's transitioned that to help the NYPD.
Thank you, Inspector. So I was a paramedic for 6.5 years, going on 7. I worked throughout all the 5 boroughs, different hospitals. I came from the 40th precinct to the medical division. I'm just glad that I can lend a helping hand to my fellow colleagues and help vaccinate the public.
Good job, thank you. Mrs. Joy?
Good afternoon. I have worked for the New York City Police Department for 18 years. While I've been working as a police officer, I decided to go back to school to get my BSN to help out the public. I'm happy that Inspector called me out to help and give vaccines to the public. Right now, I'm currently doing psychiatric visiting nurses, helping the community, visiting psychiatric clients to offer additional counseling and assistance.
Thank you. So we have, it's just two of an impressive team of, vaccinators that we have at this location and other locations. So at this time, I'd like to introduce the Chief of Community Affairs, Jeff Maddrey.
Good morning, everyone. In 2019, when this place was opened, it was opened with the vision of having a place where the community and the police could get together and engage in meaningful programs. We have a lot of academic programs here. We have sports programs here. And on a regular day, even though we're not at capacity, a lot of young people and a lot of parents as well come in here and they use this facility for their own growth and development, and this place is an outlet for them. When I was caught by Chief Morales last week, and he said, hey, we want to use the facility to vaccinate people, and me and Marty, we discussed it because we had just rolled out a bunch of programs for the community, different sports and academic programs for the community. But I realized, and we talked about it, this vaccine is very important to our communities. It's important to the city. It's important everywhere. And what better place to bring it right in the heart of East New York, right next door to Brownsville and Bushwick, to communities that really, truly need a place where they can get this vaccine. So we moved some programs around, rearranged a few things, and we were able to open the doors to let the community come in and get this much-needed vaccine. And I just want to take the time to thank Chief Morales and Inspector Gazis and the whole team back here, all the medically trained NYPD officers who are here and providing this vital service for the community. I often speak, in this role as the Chief of Community Affairs, of how the NYPD can be a very positive resource for our communities. And it's more about law enforcement, cops and robbers. We're stepping outside the traditional lines of policing. And this right here, you can't step out anymore. All right, we have officers here who are medically trained, who are providing resources to this community and getting a much-needed vaccine to them. So again, I want to thank all the members of this department who are able to provide this resource for the community, and I'm glad that I was able to help, and Community Affairs was able to help by opening up the building and giving back to the community, and that's what this building is all about. So thank you.